Hi everybody, this is Brittany's update, or case 6B. So we are now in outpatient setting 6 months post-injury with a new diagnosis of POTS. Her balance was still impaired, but she did not show any impulsivity, which was beneficial. And we attempted a DGI today, but we were unable to complete the entirety of it due to her POTS symptoms and her feeling dizzy and lightheaded. We noted that she still had some scissoring gait, and then with gait during the DGI, we noticed that she had an inability to perform head turns and also change speed, so her dynamic balance is a little bit impaired there. As far as cognition goes, she's much better than what she was when we were in the hospital. Now level 9, which is purposeful and appropriate with some standby assist on request. She did show signs of depression and anxiety today though. And for lower extremities, we noticed some weakness through myotome testing, especially with hip flexion. So we think this might be contributing to her gait deviations. And we were able to get more information about her psychosocial factors. And she was a college student. She worked at a daycare and she wants to get back to both of those things. She currently lives with her mom and her dog, Ollie, who's the black lab.
Okay, so looking at the outcome measures that we looked at throughout the 3 visits, the Ranchos Los Amigos, she improved from a level 4 to a level 5, then to a level 9. Agitated behavior skills, she improved and decreased her agitation from a 41, severe agitation, to a 29, moderate, and then 19, which is normal behavior. Functional ambulation classification, she went from a level 1, which was dependent for physical assistance, a level 3, which was dependent for supervision, and then a level 4, which was she was able to be independent on level services, but needs a little more help and supervision on unlevel services. These are just those things put into graph form, so decreased agitation, increased cognition level, and increased gait abilities.
For differential diagnosis, throughout our sessions in the hospital, we didn't notice any red flags that required a medical referral. She was tachycardic, which then later came into play with the diagnosis of POTS. We did not have to determine the POTS diagnosis or refer for this. It was determined before our treatment session. And then we just noted that we thought that she might have some hip weakness, and that was confirmed today with the myotomal testing, and we are still hypothesizing that as a reason for her gait deviations. But no red flag symptoms, no true differential diagnosis on our end.
So this is her patient care map. So it's a lot of what we've already talked about as we've got more psychosocial factors out of her today. Zach also did some safety and education for her specific to her POTS because she wasn't really sure what POTS was. We did some diaphragmatic breathing with her during her recovery and then just more safety precautions and not letting her drive at the current moment. So there's just all these other things that you can look at, but we've already talked about it previously. And then what we would have done differently throughout the process is coming up with more creative treatment interventions just because Brittany did get very bored easily. And then just having more ideas in our back pocket just because she would get bored and then we would run out of ideas and not really know where to go from there. So if we could do it again, we would just plan a little bit better and have more ideas for each session. And then we would also have a little bit more interprofessional communication with nursing staff, doing the communication with her to when Brittany ripped out her IV. We were a little bit delayed on that, communicating with the nurse. And then we would also include social work and communicating with the doctor as well. Thank you all, and we will miss Brittany.